The sterile gown is sterile on the A. Back only, B. Front and sleeves, C. Color only, D. Nowhere. The correct answer is front and sleeves. Sterile zones are the gown front, chest to waist, and sleeves. Ventral refers to which surface of the body? A. The head end, B. The back top, C. The belly underside, D. The tail end. The correct answer is the belly underside. Ventral is the belly side, dorsal is the back. Which term describes an animal that eats both plants and animal matter? A. Omnivore, which eats both plant and animal foods. B. Herbivore, which eats only plants. C. Insectivore, which eats only insects. D. Carnivore, which eats only animal tissue. The correct answer is omnivore, which eats both plant and animal foods. An omnivore consumes both plant and animal material. Carnivores eat meat and herbivores eat plants. Ringworm is best described as which kind of hazard to staff? A. A parasite spread only by mosquitoes. B. A bacterial infection that only affects cats. C. A non-transmissible condition. D. A zoonotic fungal infection. The correct answer is a zoonotic fungal infection. Ringworm dermatophitosis is a fungal infection that can spread from animals to people, so gloves and hygiene are important. Serum is plasma without A. Water, B. Red cells only, C. Glucose, D. Clotting factors. The correct answer is clotting factors. Serum lacks clotting factors because it is from clotted blood. When a nursing patient's Roman 4 line stops running, the assistant should A. Remove the catheter immediately alone. B. Ignore it until later. C. Force the fluid manually with high pressure. D. Check the line and patient. The correct answer is check the line and patient. A stopped line is checked for kinks positioning and reported promptly for correction. Which is safest when a patient must be manually restrained for a radiograph? A. Rotate staff and use lead PPE. B. Hold with bare hands in the beam. C. Remove shielding. D. Use the same person every time with no PPE. The correct answer is rotate staff and use lead PPE. Rotating personnel and using PPE limits any one person's exposure. A dog with dysuria is experiencing A. Slow heart rate, B. Rapid breathing, C. Painful or difficult urination, D. Excess thirst. The correct answer is painful or difficult urination. Dysuria is difficult or painful urination. An intranasal vaccine is administered A. By mouth as a tablet, B. Into the nostrils, C. Under the skin, D. Into a vein. The correct answer is into the nostrils. Intranasal vaccines are given into the nose to stimulate local immunity. The safest general rule about the primary X-ray beam is to A. Rest against the beam path, B. Place your hands in it to steady the patient, C. Never place any body part in the primary beam, D. Look directly into it. The correct answer is never place any body part in the primary beam. Body parts are kept out of the primary beam at all times to prevent direct exposure. A surgical timeout verifies the A. Instrument brand, B. Client's payment, C. Clinic hours, D. Patient, procedure, and site. The correct answer is patient, procedure, and site. The timeout confirms correct patient, procedure, and surgical site. When a patient shows fear aggression on the table, the assistant should a. Use appropriate low-stress restraint or a safe alternative and communicate with the team. B. Leave the patient unrestrained near the edge. C. Continue with no precautions. D. Provoke the patient. The correct answer is, use appropriate low-stress restraint or a safe alternative and communicate with the team. Recognizing fear aggression and adapting handling protects the patient and staff. The purpose of a padded, dry bed for a hospitalized patient is to a. Improve comfort. B. Make the cage look nicer only. C. Increase the patient's stress. D. Encourage the patient to escape. The correct answer is, improve comfort. Soft, dry bedding supports comfort and reduces skin pressure injuries. A drop sterile instrument is a. Reusable as is. B. Still sterile. C. Cleaner. D. Contaminated. The correct answer is, contaminated. A dropped instrument is contaminated and must be replaced. The medical abbreviation TX means a. Transfer. B. Temperature. C. Test. D. Treatment. The correct answer is, treatment. TX stands for treatment. Heartworm preventives are given to a. Sedate the patient. B. Prevent development of heartworm infection. C. Treat adult heartworms instantly. D. Cure all intestinal disease. The correct answer is, prevent development of heartworm infection. Monthly preventives kill immature heartworm larvae before they mature. They do not instantly clear adult worms. Which best describes appropriate telephone etiquette at a veterinary front desk? A. Answer without identifying the practice. B. Answer promptly, identify the clinic, and speak courteously. C. Let it ring until the caller gives up. D. Eat while speaking to callers. The correct answer is, answer promptly, identify the clinic, and speak courteously. Prompt, courteous, identified answering sets a professional tone and gathers information efficiently. Bradycardia is a heart rate that is a. Too fast. B. Too slow. C. Perfectly normal. D. Irregular only. The correct answer is, too slow. Bradycardia is an abnormally slow heart rate. A grid is used in radiography to a. Replace the lead apron. B. Warm the imaging plate. C. Increase patient movement. D. Reduce scatter radiation reaching the detector, improving contrast. The correct answer is, reduce scatter radiation reaching the detector, improving contrast. Anti-scatter grids absorb scattered X-rays, improving image contrast for thicker body parts. When receiving a controlled substance shipment, staff should a. Shelve it without checking. B. Verify the order against the invoice. C. Discard the invoice immediately. D. Let any staff member store it unlogged. The correct answer is, verify the order against the invoice. Verification against the invoice and immediate logging keep the controlled substance record accurate from receipt. Urine-specific gravity measures a. The color of the urine only. B. The patient's blood pressure. C. How concentrated the urine is compared with water. D. The exact number of bacteria present. The correct answer is, how concentrated the urine is compared with water. Specific gravity reflects urine concentration and helps assess kidney function and hydration. A urinary catheter's collection system should be kept a. Disconnected. B. Below the patient to allow drainage. C. Open to air. D. Above the patient. The correct answer is below the patient to allow drainage. Keeping the closed system below the patient allows gravity drainage and reduces infection. A refractometer is commonly used to measure A. Body temperature, B. Urine-specific gravity or total protein, C. Heart rate, D. Radiation exposure. The correct answer is urine-specific gravity or total protein. A refractometer measures refractive index, used for urine-specific gravity and total protein. The safest way to move a large, weak dog is to A. Lift alone by pulling the legs, B. Drag it across the floor, C. Lift by the tail, D. Use proper lifting technique or aids and adequate help. The correct answer is use proper lifting technique or aids and adequate help. Team lifting, slings, or carts protect the patient and prevent staff injury. Atropine is classified as an A. Diuretic, B. Antifungal, C. Antibiotic, D. Anticholinergic. The correct answer is anticholinergic. Atropine is an anticholinergic used to raise heart rate and reduce secretions. Good telephone triage means the assistant A. Prescribes drugs, B. Gathers key details and prioritizes urgency, C. Diagnoses over the phone, D. Ignores the caller. The correct answer is gathers key details and prioritizes urgency. Triage collects information and routes urgency without diagnosing. Passive range of motion exercises for a recumbent patient help A. Replace nutrition, B. Maintain joint mobility, C. Cause pressure sores, D. Increase infection. The correct answer is maintain joint mobility. Gentle prom helps preserve joint health in down patients. The correct storage of undeveloped film or digital plates is A. Near the X-ray beam, B. In direct sunlight, C. Protected from light and radiation, D. In water. The correct answer is protected from light and radiation. Image receptors are stored away from light and stray radiation. When multiple clients are waiting, a professional practice is to A. Serve friends first, B. Hide from the lobby, C. Acknowledge each and manage expectations, D. Ignore everyone. The correct answer is acknowledge each and manage expectations. Acknowledging waiting clients and communicating delays maintains trust. The main reason to wear closed-toe shoes in the clinic is A. Speed, B. Noise, C. Foot protection, D. Fashion. The correct answer is foot protection. Closed-toe, non-slip shoes protect against spills, dropped items, and injury. How many did you get right? Let us know in the comments, and tell us what topics you want us to cover next. Want to practice more? Download the app and get hundreds of free practice questions with detailed explanations.